After I retired, all of a sudden my lower back just went to hurting. My doctor, the Millennium Center, Dr. Birdie, I kept going to him and telling him that my back was just hurting. He was sending me to physical therapy, but I still wasn't getting no better. So then finally I just asked him to send me to a specialist. Just send me to somebody that all they do is work on your spine and your back. So then he sent me to Dr. Perez. Dr. Perez then saw me. He took an MRI, told me that my disc between my third and fourth vertebrae was deteriorated, and that there was nothing that they could do to strengthen or to rebuild it, but that he could do surgery by fusing the lower half of my back, which would relieve the pain. He said, but then if I do it, then the rest of your vertebrae has to pick up what the flexibility in your lower vertebrae was doing, which could then cause problems in the rest of your vertebrae. He said, so it's up to you. He said, I would not recommend it. Well, being that he wouldn't recommend it and he a surgeon, I certainly wasn't gonna go against it. So then he said, but what we will try to do is see what we can do about the pain. Then he had Dr. Tong come in.
When I first saw Walter, he had seen one of our neurosurgeon staff, and he was deemed that even though he did have a fracture in his lumbar spine, that was not bad enough to require surgery yet. However, he did have failed physical therapy at an outside facility and had reported that Motrin at the highest dose was not helping his pain, so the surgeon referred him to me to see what I could do with non-surgical treatment to try to help him.
Well, when I went to see Dr. Tong at the Michigan Head and Spine Institute, he could give me medication to try to control the pain, or he could give me injections, epidural injections.
At Michigan Head and Spine Institute, we only use medications that are manufactured by drug companies. We do not use any medications that are compounded by pharmacies for injections, primarily because of patient safety issues. We decided then to try doing some lumbar injections, and with a combination of physical therapy.
And then he said, but along with the injections, that I had to do physical therapy, because the injections alone was not going to change my condition. It would give me temporary relief, but that unless I started strengthening the core of my body, it was not, over the long range, it would not benefit.
And 2 lumbar injections, he improved well enough where he's functioning well without any problems at this time.
I've gotten a whole lot better. And now I'm even able to do more exercising on the core of my body to continuously strengthen it. And that is the main key that Patty and Dr. Tong, as well as every other doctor I've gone to, kept trying to stress, that I personally had to keep exercising and keep working my body to strengthen the muscles in order for me to get better. And so since I've been doing that, I don't have anywhere near the discomfort or the pain or anything that I had prior to going.